So I'm Dr. Rayapudi from Gastro Office. I get this question all the time from my patients about how to control acid reflux. Acid is a common issue and it really gets worse once the body weight crosses a certain limit. Usually once you hit 30 BMI and over, you start to notice it more. And 30% of the reason for acid reflux is excess weight. So that sometimes is hard to correct quickly. But there are other things you can think of which can make your life easier when you have acid reflux. Things like caffeinated beverages or caffeine can relax your lower esophageal sphincter. It's like the sphincter is a muscle that's between your food pipe and the stomach, and it relaxes when you drink coffee. 1 to 2 cups of coffee per day is okay, but anything over is going to make it worse. And you have things like garlic, onions, they do the same thing and you get more acid reflux. And the other thing most people don't know about is chocolate. Chocolate contains something called methylxanthine, and it acts just like coffee and relaxes your lower esophageal sphincter, and you get a lot of acid backup. And then things like tomatoes or tomato paste, concentrates made of tomatoes, citrus fruits like lemon, then there is lime and grapefruit. All of these make it really bad. And then mints. A lot of people think mints are okay because they eat mints and mint products to just calm it down. But it actually acts in reverse because you get more acid reflux with it. And then very common, a lot of my patients drink at least 1 to 2 cans of soda per day. So soda is a big deal. It makes your acid really bad. And sometimes they tell me they drink this Mountain Dew Sprite to just calm it down, but actually makes it worse. So that's a big deal. And then the other big factor is smoking. Smoking relaxes your muscle between the food pipe and the stomach, and you get a lot of acid backup. And if someone's smoking, I can tell you it's very hard to control acid once you start feeling it. And a lot of times smokers, once they're able to cut down, then we're also able to bring the acid medications down. And the smoking definitely needs to be considered, and one needs to be aware of it as a big causative factor for acid reflux. And so these are within your control. And taking medications like Advil, ibuprofen, Motrin, Excedrin make your acid really bad, and these are not such good medications to use long run because they can cause your acid to get worse. You can develop gastritis, you can develop ulcers in your stomach, you could have kidney problems, and it's bad for the liver. So taking Advil, ibuprofen, Motrin, Excedrin is not good for the gut. Once in a month is fine, or one occasional use, once every few weeks, once every few months, or once a month. Sometimes females have these menstrual cramps which doesn't get better with using Tylenol. So that's okay. But if you use anything more than that on a regular basis, it's going to make your acid really bad. So these are all things which you can control from your end, and bringing down your weight to a decent level, which between 25 to 27 BMI at least, would bring your acid down significantly. So some things to consider when you start feeling acid reflux.